people have weighed in. They've indicated that we want to move forward, we want to put people to work, but we want to do it in a fair method of doing it, and that is not cutting programs that impact the working poor in this country.
Well, you're absolutely correct about that. The proposal to cut Medicare benefits is a non-starter. There are things that can be done in Medicare to reduce the cost, and much has already been done. I'd like to ask my colleague from the great state of Michigan to join us. Mr. Curzon is a new member of Congress, came in a special election about a month ago. Welcome. Delighted to have you join us.
Thank you. I agree wholeheartedly with what's been said so far in this testimony. What I really want to say, into the mic. What I really want to say is Medicare is run more efficiently than nearly any insurance company in the world. They devote less than 2% of its funding to administrative expenses. And you compare that to a private insurance company that costs up to 40% of premiums for individuals and small group plans for administration and to pay their executives 6- and 7-figure salaries to do the same thing that's administrated by Medicare officials. Also, the attempts to move Medicare eligibility from 65 to 67 sounds like an easy fix. Well, not only, as was spoken earlier, the recipients, those people that are 64, 65, 66, going into that category, are people that possibly are already struggling, lost their jobs, they need that health care, they have a pre-existing condition, and now their very life is threatened, having to wait that much longer. And we all look to take care of small business and private insurance funds, such as VEBAs and those type of institutions that money is forecasted to pay for various health care, and you stretch out 2 more years of their coverage. Small business now has to pay higher premiums to cover those employees that last those 2 more years, and they either have to make a choice. They reduce what they give in coverage, or they eliminate it altogether, or they shift those premium costs to the worker. It's happened over and over and over again, and we need to avoid that in this coming legislation.
Mr. Curzon, thank you so very much for your thoughtful discussion of the age issue. It's a profoundly important one, and also bringing up the issue of what is the cost of Medicare administration compared to the private health insurance companies. You're quite correct. Medicare is a very efficiently run program, very efficient in collecting the money and paying the bills, far more than you would ever find in the private health insurance sector, perhaps by a factor of 4, 3, 4, maybe even 5 in some cases. Also, Medicare has had an extraordinary run of keeping the cost down. I'd like now to call upon Mr. Joe Courtney of Rhode Island, Connecticut. Well, I've made 2 mistakes today about my colleague's locale. Joe, it's yours.
Thank you, Congressman Garamendi, and I realize there's congressional districts in California that are probably bigger than Rhode Island and Connecticut combined, so I won't hold it against you too hard. And thank you for taking the time on the floor today to spend some time talking about Social Security, Medicare, and Medicaid. This really is the moment of truth right now. Yesterday, the Republican leadership came out with their package in terms of trying to deal with the so-called fiscal cliff, and even though for months they have not really fleshed out with great detail where they wanted to see savings, yesterday they did. They came out with a proposal which talked about raising the eligibility age for Medicare from 65 to 67. They talked about recalculating the cost of living adjustment for seniors who are on Social Security. It's the so-called chained CPI, which would lower the year-in and year-out increase for people on Social Security in terms of keeping up with the cost of living. And these proposals really need a full, vigorous debate before the American people before we move in that direction, which I would argue, and certainly you and others here this afternoon, would be the wrong direction for middle-class and working family Americans. You know, in terms of Medicare, I think it's really important historically to review how Medicare came into existence. In 1965, when it was signed into law by President Lyndon Johnson on the porch of Harry Truman's house in Independence, Missouri, only half of America's seniors had any insurance whatsoever. Because of age, because of pre-existing condition, because the insurance companies frankly just viewed them as too high a risk, and because of cost, only half of America's seniors had any insurance whatsoever. Life expectancy in America in 1965 was 70 years old. With that stroke of a pen by Lyndon Johnson, the genius of Medicare was created, which created a pool for people above the age of 65 and people on disability, a pool which could spread risk out and make the challenge of covering people at that age much more manageable. And for the following 47, 48 years, we have had a system which now has brought life expectancy for Americans up to age 78. In other words, having people in a situation where they can access needed medical care, in fact, lengthen people's lives, in some instances actually added to the economy, because some people even continue to work to a degree who are on Medicare. It has really accomplished its mission, which was visualized the day that President Johnson signed it into law. It does face challenges. There's no question that demographics, with the baby boom coming on the horizon, is going to increase the number of people in the program. But the way you solve that problem is just make it smarter and more efficient. And when President Obama signed the Affordable Care Act in March of 2010 last year, there were some really solid, smart changes that were made to the Medicare system to make sure that the cost per patient would be moderated, but not that it would cut benefits or kick people off the program, which is what the Republicans are proposing to do, saying people who are 65 and 66 would no longer be eligible under their proposal. And this chart, which I brought along with me this afternoon, is based on Standard & Poor's Dow Jones Index, which tracks the Medicare program every single month in terms of per capita spending. And it shows, again, back as recently as 2005, 2006, per capita expenditure for Medicare was actually quite high. It was over 7% per patient. And that obviously is an unsustainable level under almost really any circumstance. But over time, it moderated. And then this red line shows the day that President Obama signed the Affordable Care Act, which put a number of really intelligent changes into Medicare, promoting preventive care services, prescription drug coverage, making sure people will get their colonoscopies and their cancer screenings, and also saying to hospitals, hey, if people show up at your emergency room 30 days after you just treated them, we're going to penalize you. You've got to do a better job of monitoring care in the community. And that change by itself is already promoting a lot more collaboration on a much more cost-effective, better way for people. Who wants to be in an emergency room? You want to be home with your care being provided, not sitting in a hospital emergency room waiting for life or death treatment. And so since that date, when President Obama signed it into law, the per capita growth rate under Medicare is now down to its lowest level in the history of the program, of 2% per capita growth. And the fact of the matter is we can do more. We can actually build on that success of the Affordable Care Act. Anybody who watched 60 Minutes on Sunday, they had a story about a hospital system which basically was threatening to fire doctors if they didn't admit patients according to certain quotas. Because they're, again, chasing that fee-for-service incentive that is in old Medicare. I mean, those are the kinds of, in that case, fraud, but in other instances, changing that fee-for-service incentive can actually bring this number down even much more dramatically, and we don't have to touch a hair on the head of any Medicare-eligible senior in America for decades to come if we make those smart changes. So the fact of the matter is we're seeing great progress. just again in the last 2.5 years. And the fact is that there are very good ideas about ways of making the system much more efficient. And I will tell you, and I know my members that are here on the floor will agree with this. I mean, when you go and visit a hospital or when you go and visit medical groups, the changes in electronic records, the changes in terms of incentivizing preventive care has been embraced by the medical community. They actually understand how wasteful the high-volume fee-for-service system is in terms of just not only taxpayers but also the resources that are precious and should be really allocated to all Americans, not just those who have good insurance that can reimburse for those procedures. So the fact of the matter is we can do far better than kicking 65 and 66-year-olds out of the system as a way of protecting Medicare solvency. And that should be the direction that we go with these discussions over the financial future of the public finances of this government. And again, I want to thank Mr. Garamendi for organizing this, this discussion here today, because it's important to get these facts out.
Mr. Courtney of the great state of Connecticut. Thank you very much for bringing this information to us. Your chart is a dramatic one when you consider the period of time and the extraordinary reduction in the inflation rate in Medicare. If you had another line on that showing the general inflation in health care for the general population, it would actually be above Medicare, that entire slope all the way down. Significantly above it. So what's happened, in part, I think you're correct. There may be other forces involved here, but certainly you can see the effect of the Affordable Health Care Act. And you identified very well some of the critical cost savings that are in that, and it's well worth repeating it, which I will do with you, and we ought to go back so the public comes to understand what was in the Affordable Health Care Act. For those over 65 that are in Medicare, those changes are critically important. First of all, stay healthy. Boy, you want to save money on the hospitals and doctors. Stay healthy. And so you have an annual wellness visit. And I think something like 50, 60 million Americans have been able to take advantage of that free annual visit. They go, oh, you got high blood pressure? Well, let's take some blood pressure medicine. You headed for diabetes? Here's a program of dietary program or exercise program. We can deal with those. You keep people out of the hospitals. The hospital infection rate, the other one you talked about, very powerful. I hear from hospitals in my district, and I'm sure my colleagues do also. Well, they don't want that readmission because that comes right out of the hospital's pocket, and also there's a penalty. So there are many, many issues here that are involved in the Affordable Health Care Act that have caused that slope downward to continue. Enormous savings to Medicare, because when you look at the Medicare issue, it's a projection for 10 years. And the projected rate 2 years ago was like 5, 6%. And where are you, down in the 2% range now? Yep. Those are multi-billion dollars a year that the American public will not have to pay in taxes and increases in the expenditure. So these things begin to add up. But there are many, many more savings. I don't want to dominate all this time. I see that other of our colleagues have come and joined us. And I think it's your turn, Peter. Peter Welch from, I've been missing all the states. Would you like to maybe be from Alaska or, well, we'll just say Vermont.
I kind of like Vermont, but thank you. You know, this is such an important issue about the future. We can get a deficit deal. The President is committed to doing it. It's got to be balanced. Balance means there's got to be revenues. You know, our taxes, especially from the high income, are at historic lows. We have to have health care reform, and that can get the cost of health care down. Bring that rate of growth of spending down. You know, in Vermont, that's what we're trying to do. We're a single-payer state. We're trying to move towards a single payer, and the reason is that it's the best way to get our arms around the cost of health care so that you can continue the access. And we know that there are reforms that we can make in Medicare. You know, just for example, if we purchase drugs wholesale, why do we pay retail? You know, in the VA and in Medicaid, the government is a big purchaser, and it negotiates price discounts with the pharmaceutical companies that are quite eager to sell their prescription drugs to Medicare and to
If I might interrupt you for a moment, under the current law, the U.S. government Medicare program is prevented By law.
It's illegal to be a smart shopper.
Huh?
That's exactly right. You can't make that up. It's illegal if you're in. It would be like telling you if you went into CVS to buy some aspirin, and you had the option, and you knew you were going to use them for a year. You had a family. If you wanted to buy the bottle that had 100, and the per unit price is 1/3 of what it is if you're going to buy the bottle of 20, it would be illegal for CVS to be able to sell it to you at a lower price per unit. So that's what we have in Medicare. So, you know, everybody understands you've got to pay for what you're going to get. But the fundamental debate here, and this is what was reflected in the Ryan budget with the voucher plan, is are we going to try to address what are obvious failures in the system of the delivery of health care, like not allowing for prescription drug price negotiation. That would save $165 billion, and it wouldn't cut a single benefit. Or are we going to allow that system that makes no sense to continue and instead take $165 billion worth of benefits out of Medicare so that if you go to the doctor, they may treat you for a broken wrist, but not a broken forearm? Okay, it doesn't make sense. And it certainly doesn't make sense to start talking about benefit cuts before you have the system reform and can get savings that are literally right on the table in front of you. So we can deal with this debt situation that we have in this country. It is serious. You know, Democrats understand that. The President understands it. It's a serious problem. It's a solvable problem. But to solve it, we have to have a significant contribution from revenues. The top 2% can afford to have their taxes go up to the Clinton year rates. That's number one. And number two, we can have reforms in health care that would benefit not just Medicare sustainability, but health care expenses, whether you get your health care at work through your employer or whether you're a private pay person. And the nice part of this is that we are all in it together. So thank you for doing this, and we can solve this problem, and let's do it.
Mr. Welch, we will do it. And Mr. Courtney from Connecticut has some ideas about other things that we can do.
Well, you know, again, I think it's important, and you touched on this, John, was that, you know, when the Affordable Care Act was passed in March of 2010, the Congressional Budget Office was projecting out some savings because of the ACA, but they were figuring about 4% per capita growth. Again, as you pointed out, this chart now shows we're down to 2%. So they have actually been revising their estimates over the last 2 years, and the net savings, the recalculation, just in the last 2 years has been hundreds of billions of dollars of lower expenditure than they had first thought was going to be the case. When you compare that magnitude of savings with, for example, raising the eligibility age to 67, I mean, they're dwarfed. It is really just a small portion of what efficiencies in the system are capable of producing. And the fact of the matter is that raising the eligibility age, I mean, there's no free lunch. I mean, the fact is that even though these are people that will be challenged in the private insurance market, 65 and 66 are still the healthiest population within the Medicare pool. So the ones who remain in Medicare, their Part B premiums are going to go up. And that's not just me saying it. It's the Kaiser Family Foundation who analyzed the impact of raising the age to 67. You're going to raise premiums. You're going to obviously leave people in a horrible situation in terms of trying to find any insurance at that. And in the private market, which you regulated, you know that is the roughest area there of older working age individuals. And the net effect in terms of overall health care costs in terms of the system is zero. In fact, there's some who would argue that it would actually add cost to the system.
Well, I think it really would add cost. When we discussed earlier that the Affordable Health Care Act has a very powerful cost-saving mechanism called Staying Healthy.
Right.
And that's the prevention programs. If you move that age from 65 to 67, you're going to have a significant population of seniors who will not have access to that preventative medicine program. It's not going to be there for them. So the potential for them to develop long-term debilitating diseases increases, and when they get to Medicare, they will be much more expensive, to say nothing of what happens to them during the 2-year period when they can't get to Medicare. You said something early on. I'm going to go back to this. You talked about what happened before Medicare. The 50% of the population of seniors without medical insurance, the poverty rate. And when you said that, my mind flashed back to when I was a young man in the 1950s, actually not even a teenager. My dad took me to the county hospital. We were ranchers out in the boondocks of California, and nobody had insurance who was in the senior years. The county hospital sticks in my mind as the reason for Medicare. I mean, it was beyond horrible. There were just a row of beds, the most horrible odor in that ward, people dying. It was so compelling. And today, there are issues out there, but we have seen the population of seniors healthy, living longer, 20 years longer than they were just 45 years ago, 50 years ago now. This is so important to seniors. And it is the Democratic Party that has stood for Medicare all of these decades. And we're not going to let it go. We're not going to let Medicare go. It is a foundation of our humanity and our compassion as Americans for all, because all of us want to live long enough to get into Medicare. Reforms are possible. We've talked about several of them here today. I know that our colleague from Michigan spoke earlier. If you'd like to come back in and talk a little bit about this, we'd welcome you. And we'll go back here for a little longer. Please, Mr. Cuozzo.
Well, again, as we talked of earlier, it seems to so many in the public that moving that age, particularly younger Americans, that just going from 67 or 65 to 67 doesn't mean a lot. Well, if you look at the statistics of age in this country, that's the baby boomer generation. That's the greatest population this country's ever had, is right in that area. I'm part of that. I'm 64, and so many of my friends cannot wait 2 more years for health care. They can't afford the out-of-pocket. Some have pre-existing conditions, and without a question, if we move this, it will be a sentence of death for many, many Americans who won't be able to get the health care that they need. As I went through and campaigned, I come from a district that was 60% Republican. It didn't matter what forum I was in, what group I talked to. Nobody, there was no great calling to change Social Security, or change Medicare, to take benefits away, to raise the age. There was a lot of calling to take the corruption out of Medicare, to take the phony doctors and the phony bills and other systems, just as we talked about, not having the ability to negotiate prescription drugs. Millions and millions and millions and millions of dollars just to make that part of the system competitive. We can't do that by law. That's ridiculous. Those are things that easily we could go in, we could do, and we could make this system much better without touching a single benefit for any American.
You know, you're mentioning about the fact that there may be some young folks out there who might be of the belief that this is really not a big deal to bump that age up 2 years. I mean, the fact of the matter is that some of the folks who've, again, analyzed the impact of raising the eligibility age is that it would spill over to young Americans, and here's how, which is that there are a lot of private employers that have health insurance plans that when people hit retirement age, 65, or their hoped for retirement age, they are able to, again, move into Medicare. They come off their employment-based plan, maybe get some supplemental coverage as part of their retirement package. But the fact of the matter is that helps move people out of the workforce at an appropriate age of 65 and open up jobs for younger Americans. To the extent that you now are going to say that Medicare will not be there till age 67, it frankly is going to force a lot more people to stay in the workforce longer than I think really most people believe would be the case today. So in fact, it would create that job lock that would prevent, again, the workforce to continue to refresh itself with young Americans. So the fact is having a solid retirement health insurance plan like Medicare helps young Americans because it again, allows the workforce to continue to circulate people, older Americans out and younger Americans in. And that's why, again, the folks who have the genius to have the strength to pass Medicare in 1965, they solved a lot of problems in the U.S. Economy and U.S. society that really extended far beyond just the patients who that program covers.
Well, there's certainly a series of things that we know we can do to reduce the cost of Medicare. Some of those are already in place. They've been brought forward by the Affordable Health Care Act. Others are yet to be done. The prescription drug issue is out there. Enormous savings, I think 160, 150 billion right there over a 10-year period. The fraud in the system, some of that was dealt with the Affordable Health Care Act, but there's much more that can be done. There are fraudulent billings for durable medical equipment as well as other kinds of services that are provided. Those need to be addressed. The systems that are being put in place, that is moving away from fee-for-service, will significantly address that. And there are, in the area of hospitalization, again, there are programs that are viable, that are not yet implemented, that are not part of the savings that have already been calculated. For example, programs on the dual eligibles. The dual eligibles are those people that are that do not have sufficient income, but are already quite ill, that may be 20 years of age, and they're getting Medicaid as well as Medicare. There are savings that will be found in the way in which we organize that. For those seniors that are in Medicare, an organized health care system that keeps them healthy, that is taking the prevention program a step further or 2 or 3 steps further, so that there is a continuity of care and there is a follow-up, maybe a social worker or simply somebody on the phone saying, how are you doing? Are you taking your medicine? Are you able to get the food that you need, so that people can stay healthy? Healthy population significantly reduces cost. The use of the Affordable Health Care Act, not just for Medicare but for the total cost of the system, has a very, very powerful cost reduction in it, and it's called insurance. 40 million Americans are going to be insured. That means that those people are less likely, far less likely, to go to the emergency room to get their care. The Affordable Health Care Act also provides for clinics where a private doctor may not be available, a clinic would be available. So all of these things provide more care to people, and in doing so, reduce the cost of the extraordinarily expensive care that comes from when people don't get continuing services of health care. So Medicare is a huge issue before all of us, and on the Democratic side we're saying yes, there are savings available in Medicare, we should take advantage of those, but we're not going to cut benefits, and we're not going to privatize Medicare or end Medicare as we know it. There are other things that we can do. We're willing to do it. Let's compromise on those things that make sense without destroying the Medicare program. Not on our watch are we going to see the benefit package reduced in such a way as to harm seniors. No way. And no way are we going to end Medicare as we know it. We'll draw a line in the sand. We'll save the money. We'll put that cost curve even on a better trajectory, and that is a very, very formidable and positive trajectory there. Let's spend just a moment of time as we come towards the end of our time on Social Security, which many people, well, not on our side of the, not on the Democratic side, but let's talk about Social Security and should it be on the cutting table here? Should it be part of the deficit reduction?
Well, again, what's remarkable, and I know both of you are well aware of this, is that Social Security over the last 3 or 4 years, 2 out of those last 4 years, there was no COLA. There was 0% increase for seniors on Social Security. And again, as we all know, that's a formula that's tied to a Labor Department basket of goods that they spit out every year since the 1970s when COLA was first enacted. And where the economy was at that point produced that result. Now, the last 2 years, there have been moderate increases through the COLA formula. But again, the Republicans want to go deeper. They want to come out with a new cost of living adjustment formula called the chained CPI, which would depress the existing COLA formula that already ended up with a 0% out of 2 out of the last 4 years and make that even lower for seniors. Now, you know, as I think many of you know, you go to a senior center and you talk about what, how come we didn't get a COLA this year, or how come the COLA is so small, and you explain to them the way the formula works. Well, the fact of the matter is that Labor Department formula that we have today uses a lot of goods and services that seniors don't buy. They don't buy flat-screen TVs. They don't buy laptop computers, where prices have come down because of competition in those areas. They concentrate their spending on food and fuel and prescription drugs, which, if you look at just that basket of goods, the COLA would be higher than the existing formula, and certainly not lower. And so, for the Republicans to come out with a proposal that says we should depress the COLA formula that we have today, that again really doesn't match up with the profile of what a senior goes out to the supermarket and buys 1 week to the next, is really going backwards in terms of really the economic security of people over age 65. And I know the gentleman would like to share his thoughts from Michigan.
Well, and I think in the great majority of our citizens don't understand that Social Security is not funded by tax dollars, that the confusion lies because over the years the contributions made by workers to fund Social Security created a surplus, and with that surplus they loaned that surplus to other government funding projects, and they're being paid back with government money. And that government money every year is now playing in to the repayment, and that's why people think that you can cut Social Security to take the tax dollars out. Well, if that was a private insurance company that had a surplus and loaned that surplus to another company, that first company would expect the second company to pay it back. So that cannot be part of this equation. Social Security and the federal money that goes into Social Security cannot be part of the equation in this fiscal cliff debate. Now, certainly, with the expectancy of Social Security only surviving until 2038 before it has reduced benefits, in the very near future, this great hall, has to discuss how to fix that, and all the great minds in this hall, I'm sure, can. But it does not need to be a part of this debate. This does not have to be it should not be a part of whatever legislation we settle in this last lame duck session of this Congress.
Well, you're certainly well stating my position, and I believe the position of our colleagues, and I believe the President. Social Security is not part of the current deficit problem. It is an issue. We'll have to deal with it any time between now and the next 7, 8 years, and we can. And it's been done before. At least 3 times in my memory, Social Security has been adjusted. One was discussed earlier with the issue of the COLA. That's been adjusted. There are things that can be done to deal with Social Security. But that is a debate separate and apart from the deficit and the fiscal cliff debate. The fiscal cliff debate is a tax issue, and it's also a spending issue. Today we focus largely on the issue of what are we going to do about Medicare, a big part of the federal expenditures, and our argument is this. We're here to protect Medicare for seniors, period. We're not here to cut the benefits for seniors. We're here to see to it that Medicare, which has been a program for seniors since 1964-65, is going to continue to be there for seniors, and the benefit package that's there. There are reforms and changes that can be made to reduce the cost of Medicare, but not to reduce the benefits. We've talked about many of those, and so here's where we're coming. Within that area, there are very, very significant savings that can be done. The prescription drug benefit, $150 billion over 10 years. Other issues having to do with keeping people healthy to extend their health care. Issues having to do with how much we pay for certain services, fraud and abuse. All of those things could add up to the potential savings, not to the potential, to the savings that the President has called for, which somewhere in the range of $300 billion over 10 years, additional savings over and above what has already taken place in the Affordable Health Care Act. And we've seen in this decline in the inflation rate in health care some of the effects of the Affordable Health Care Act. So there's things that can be done and will be done. Social Security, not part of this debate. But I also want to point out here in the last closing minutes of this a couple of things that I think are very, very important. The President has put forth a very detailed program calling for $1.6 trillion in additional revenue over 10 years. And that is money that is to come from the expiration of the George W. Bush tax cuts for the top 2%. Now, I want to make this clear. I said this earlier. I guess it's worth repeating because it's not said very often. Every American taxpayer gets a tax reduction. The super wealthy to the very minimum taxpayer in this nation gets a reduction in what the President is proposing, and that is to continue the current tax rate on those under $250,000 adjusted gross income. For those who have income over and above that, they get that tax reduction, and above that, they're going to pay an additional amount up to 3.9% in 2 different tranches. So everyone gets a tax break, but those super wealthy, the 2%, they're going to pay more, and that will amount to a substantial amount of money over 10 years. And frankly, they've had 12 years of really low taxes, the lowest taxes really ever since the 1930s. The President has also proposed something that's very important. We talked about this last week. I want to talk about this again the next time we come here, and that is, how do we grow jobs? How do we put people back to work? The President has proposed an additional $50 billion. He did this more than a year ago in the American Jobs Act, and he's put it back on the table. $50 billion of infrastructure. Let's build the foundation. That deserves a lot of discussion, and frankly, it's something we ought to enact here right away and put people back to work. And there are other savings that he's proposed over the course of the next 2 years. We don't have time now. I notice our time is just about expired. You want to take a final shot at this, Mr. Curzon? And by the way, this is the first opportunity I've had to spend part of my hour with you. You're a very articulate spokesperson for the working men and women in this nation. You know the issues of Medicare and Social Security so very, very well. And I know, coming from Michigan and Detroit, you know the need to build the job portion of our economy. So why don't you close, and then I'll wrap this up.
Without a doubt, and I thank you for that, and I thank you for your comments. But without a doubt, we could take an hour talking about rebuilding the infrastructure, the jobs it would create, the need in America to do our bridges and our roads. If you're about to drive over a bridge, you want it safe. It doesn't matter if you're a Republican or a Democrat. You want that bridge to hold you and your car up as you go over it. That needs to be done. Much of our infrastructure is crumbling. The power grid is crumbling. If it goes out, it doesn't matter what party that you have. You want your lights on. You want your refrigerator to work. You want your house warm. So all of those things that could be done and put America back to work and create revenue from people working, when they get that paycheck, then they have money to send their kid to a dance class or to go get a haircut. All the small business in the area spawn off of that money from creating jobs, rebuilding our infrastructure. That should be on the forefront of our agenda, and I certainly hope we have a chance to talk about that.
How about next week? We'll come back to the floor next week, and we'll pick up the issues of infrastructure, of jobs, and the like. This week, we need to focus on what has been put on the table by the Republicans and the Democrats on how to deal with the fiscal cliff, dealing with the issue of Social Security and Medicare. Social Security, no, not part of this problem, something we'll deal with perhaps in the next Congress or even in the one beyond that, because we do have time to deal with Social Security. Medicare, for those who want to privatize Medicare, end it as we know it with a voucher or a premium support program, no. No way, no how are we going to go there. For those that want to work on changing the way in which Medicare operates to get savings such as negotiating drug prices, dealing with fraud and abuse, the various payment systems that are in Medicare, all of which can save money, and to continue the work of the Affordable Health Care Act in the way it has already brought the inflation rate down from the 4%, 5% range down into 2.5% range. This is an extraordinary savings right here. And that will be calculated in the years ahead, and this will add up to frankly, this will add up to hundreds of billions of dollars in the reduction in the projected cost of Medicare in the years ahead. So we're making progress. We've got work to do, and we're prepared to do it. The Democrats are prepared to put together a compromise. Let's get to work on it. The American public expects us to do that, and we can and we will. With that, Mr. Speaker, I yield back. Thank you.
Oh, all right, great. The gentleman yields back, and under the Speaker's announced policy of January 5th, 2011, the gentleman from California, Mr. Lundgren, is recognized for 1 hour as a designee of the Majority Leader.
Thank you very much, Mr. Speaker. I take the floor at this time to talk about an issue that is of utmost importance to this country, one that I have worked on for several decades, and one that has an urgency to it that cannot be denied, and that is the issue of immigration. It is a multifaceted issue, one that has a number of subtexts to it, but nonetheless is one that will not be confronted. The challenges will not be met unless or until we recognize the problem or the challenges as they truly exist. And what I mean by that is this. Immigration, in all its aspects, is a part of the heritage of this country. Immigration is the cornerstone, one of the cornerstones of this nation. It has been said, and I think it is true, that this is a nation of immigrants. And what that means is that most of us, with the exception of those who are Native Americans, trace our ancestry to some foreign country, some foreign shore. The rate of immigration has gone up and down over the 2+ centuries of the existence of this country. It has varied in terms of where the greatest numbers come from over the centuries. It has resulted from and has been altered by decisions made by previous Congresses and presidents in terms of the laws that prevail with respect to immigration. But the fact of the matter is that we now are facing a question of immigration policy that has not, in fact, worked for some period of time to the extent that is necessary. There are several aspects of it, as I mentioned before. One is the area of legal immigration. This country has a glorious history in terms of inviting and accepting and embracing peoples from all over the world. I think I can say without contradiction that this country has had the most open policy with respect to immigration over the years of any country in the world. We had restrictions at times, some that, as we look back now, appear to have been at least misguided. We have had some discriminatory practices in the past with respect to people from certain parts of the world, certain parts of Asia at times. There was, in fact, a bias, if you will, towards Europe, and particularly Western Europe, over a number of years. But in the 1960s, there was a decision made in this country by way of our laws that moved us towards a worldwide quota system, meaning that the chances for peoples around the world were to be in some ways viewed as equal, meaning that we did not have a bias towards Europe. We did not have a bias towards some other part of the world. The idea was that we would try and make our immigration policy work such that someone who wished to come to the United States from a country in Africa or a country in Asia would have a similar chance as existed for someone in Europe. So that was a major change in our overall policy. When I came to Congress in 1979, that was essentially where we were. But we also realized that there had been a lack of enforcement of the laws with respect to legal immigration, such that we had a significant number of people who had come to the United States without the benefit of papers, or to say it another way, who had come into this country illegally or had overstayed their legal status in this country and were now here illegally. Now, one of the consequences of a lack of proper enforcement, one of the consequences of having large-scale immigration is that it overrides in a significant way the law that would look out and say, no matter where you're from in the world, you would have approximately an equal chance of coming to the United States. And if you had illegal immigration from particular areas of the country, that would in a sense create a bias under the practice, if not the actual law, for that part of the world. We found, interestingly enough, that the largest number of people who had come into this country or were in this country without proper documentation came from Central and South America. The largest number of them from a single country, that is Mexico, which is not altogether surprising when you realize we have a common border with Mexico that ranges from the Gulf of Mexico to the Pacific coast and is approximately 1,960 miles long. And if you have visited it, if you have traveled along its entire length, as I did back in the early 80s as a member of the Immigration Subcommittee, you will find the topography such that it is difficult at times to actually have a border that is marked and a border that is controlled. Nonetheless, that does not excuse us for not exercising the control that we should have. Because of the fact that we had this dilemma of a large number of people who had come to this country illegally, and at the same time we were attempting to enforce the law such that a worldwide quota system would still, in fact, be worked. In the 1980s, there was an effort to try and reform our immigration laws. I was a part of that as a member of the Immigration Subcommittee. We were, as Republicans, in the minority at the time, so as the top Republican on the subcommittee, I was not the chairman. I was, in fact, the ranking member. I am pleased to say that at that time I had a great working relationship with the then chairman of the subcommittee, Ron Mazzoli, a Democrat from Louisville, Kentucky. Perhaps the fact that we both were graduates of the University of Notre Dame and shared an affinity for our alma mater assisted us in working closely together. And also, coincidentally, there had been a commission established to look into immigration, a bipartisan commission established in the first instance by President Carter and continued on by President Ronald Reagan. And it was co-chaired by Father Theodore Hesburgh, the former president of the University of Notre Dame, a person much admired and someone that I had known for most of my life and Ron Mazzoli had known as well. And in a very interesting way, we worked together acknowledging the proper roles of the Commission and the Congress and shared information and I think shared the same hope that we could come up with legislation that would reform our laws. In 1984, we passed an immigration reform law here in the House of Representatives, and there was a similar law passed in the United States Senate. There was a call for a conference, and in a practice that is somewhat different from that you observe today in the Congress, at least for the last several Congresses, at that time you actually had a physical conference where you had members from the Senate and the House representing those two sides of the Capitol, meeting in public session, attempting to try and work out a conference report. I recall meeting in a large room where the table as it was set up in rectangular fashion was was very large to accommodate all the members of the House and all the members of the Senate who were there attempting to try and deal with the issue, and our staffs assisting us. And we spent, I think, actually an entire month in conference attempting to work out a conference report. We were unsuccessful. We came back in 1985 in the new Congress and began working both in the Senate and the House. And at that time, the name of the bill, the common name of the bill, changed from Simpson-Rodino to Simpson-Mazzoli, recognizing the tremendous effort made by the chairman of the subcommittee, Ron Mazzoli. And I recall being at this position on the floor of the House when this was the minority leadership table, being the Republican floor manager of the Simpson-Mazzoli bill. We spent well over a week on the floor debating. As I recall, we had well over 200 amendments that were in order, most of which actually got debate on the floor of the House. And there was consideration of issues, sub-issues within the overall issue of immigration reform that I think went from liberal to conservative, from issues of legal immigration to illegal immigration, agricultural work, seasonal workers. Just about everything was considered on this floor in an almost totally open debate. I was proud to be a part of that debate. I was proud to have garnered the sufficient number of votes on the Republican side to join with those on the Democratic side so that we passed that bill. We went to conference. We completed action on that. We sent the bill to the President. And I can recall driving back to the residence I had here in this area on an afternoon when I was listening to the radio and hearing the report that President Reagan, or the White House had announced that President Reagan was going to sign the bill. I almost drove off the road at that time. I recall that I had worked with the administration, but it was not a perfect bill. I've never found a perfect bill here. And there were many naysayers. And so you were never sure until the President made the decision that he would sign it. And I was pleased to be at the White House when the President signed that bill. It was a true compromise. It did result in the largest legalization that we'd ever had in the United States. I don't believe it was a total amnesty. I would reject that notion, but it was, in fact, a legalization. But the genius of that compromise was that there would be legalization on the one hand, and there would be enhanced enforcement going forward on the other. And if one would look at the reports of illegal immigration that followed the signing of that bill into law by President Ronald Reagan, one would see an interesting thing. The numbers coming across our southern border dramatically dropped immediately after that law was passed, in large measure because of the belief that, the widely held belief that, in fact, we would enforce the law. And there was enhanced enforcement. And we're going to be serious about it. And I haven't looked at those numbers in a long time, but it seems to me, as I recall, that for a period of maybe 12 to 18 months, we saw a significant drop in illegal immigration or illegal migration into this country. And then it became evident that enforcement was going to be slow, if at all. And the fact of the matter is there was not enforcement. There was not enhanced enforcement. There wasn't enforcement. There wasn't a serious effort. And that was a combined result of a failure to follow through on the part of the Congresses and administrations. So as a result, after a significant drop for a short period of time following the passage of and signing into law of Simpson-Mazzoli, we saw a ratcheting up of illegal immigration into this country. And that was in 1986. So fast forward to the present time. We have had the result of that ratcheting up of illegal immigration into this country. We have had a situation in which, since people saw that we weren't going to enforce the law, there was an encouragement, in essence, to come to this country any way you could. And there was, as the sociologists call, the magnet that caused people to come to this country, or invited people to come to this country, or attracted people to this country. And that magnet, otherwise known by sociologists as the pull factor, was called the prospect of jobs. I had argued on the floor of this House back in the 1980s that, in fact, we had to recognize the reality of the reliance of American agriculture on foreign workers to a significant degree. Now, I'd come from the Southwest. I'd come from Southern California. I had seen that close up. I had gone to the fields. I had seen the conditions in which people would live just for the possibility of coming to the United States for a job. I had seen that since we didn't control it in a fashion that the government actually determined, we, the people, through our government, determined the number of folks, the number of jobs that would be available, determined who would come in, how long they would stay, under what circumstances they would work, and what areas of the country they would work, that because we didn't do that, it happened anyway without any controls whatsoever, and the problem was exacerbated. One of the fundamental changes I've seen, or differences that I've observed, being in the Congress this last 8 years as opposed to the 10 years I was from 79 to 89, is that the problem, as I saw it in the Southwest, is not nearly confined to the Southwest now. It is, in fact, a national problem. You will find the presence of those who are here illegally working in agriculture all over this country. You'll see the increase in seasonal work because you'll see the increase in the demand for quote-unquote local produce, locally grown crops. And as you see that, you see the demand for seasonal agricultural workers expanding to other parts of the country. And we don't control it. We don't have a workable system. Some people say, well, we have the guest worker program under the Labor Department, the H-2A program. It frankly doesn't work. It works for about 4% of the agricultural industry in the United States. And I say that as someone who helped draft the legislation as a part of Simpson-Mazzoli, not because that's what I thought was the best we could do, but it was the best that was able to be accomplished in any legislation that was going forward. And so we now are confronted with a situation in which we have had large-scale illegal immigration into this country after the passage of Simpson-Mazzoli and the failure to enforce the failure to implement the enforcement side of that. We also are confronted with the question of legal immigration and the fact that right now, I believe, we set aside too many visas for those folks who have particular skills that we believe might help this country at the present time. And I'm not in any way denigrating unskilled workers, and I'm not in any way denigrating those people who come to this country without skills and then develop them once they're here. Our history is replete with those who have accomplished great things, having come to this country with nothing more than a desire to do well, a commitment to hard work, and using the intelligence and the other skills or skill capacities given them by God. But I do say it makes no sense when we have a situation in which we take peoples from around the world who come to this country because we have the greatest colleges in the world and who develop expertise in science, technology, engineering, mathematics, in areas that might have an immediate impact on some of the most important growth industries as we look to the future. When we say to them, if you get your degree here, You got to go to your home country for several years and then apply to come back to this country in order to work here. But Canada will allow you in right away. Many other countries will allow you right away. Or you can back to your home country and thereby compete with the United States economy in an emerging economic growth in your home country. I saw this very, very closely at hand when I saw one of our major technology companies actually build a plant just over the border in Canada, utilizing a core of those people who had graduated from American colleges, had come from foreign countries, and were immediately accepted into Canada. And then Canada was able to build a workforce of about 1,000 people around a core of probably no more than 100 people that would have been required to go back to their home countries from the United States. They basically said, hey, you don't have to go there, you can come to Canada. And we lost the potential for 1,000 jobs going right across the border because of a policy which doesn't fully understand the appropriateness of us matching up with those people who have particular skills and wish to come to this country or stay in this country after they've been trained in this country, and their skills and our needs. In some ways, now we did vote on the STEM Act here this past week, which was one attempt at dealing with that question, but only one attempt at dealing with that question. In some ways, in my judgment, the changes we need to make in legal immigration have been, I don't know if I'd use the word or term held hostage, but they certainly have been put on the back burner because of the desire for us to deal with a true problem that is more prominent, and that is illegal immigration. So why am I talking about this? Well, I'm not going to have the chance to work on this after January 2nd. While I devoutly desired the opportunity to do that, there has been a decision made otherwise. And I still have the passion for dealing with this issue because I think it's so important to this nation. I think it goes to the identity of this country, and I think it goes to the future of this country. And I reject the notion that we either have to be a nation of immigrants or a nation of laws. I think we can be both a nation that welcomes immigrants and a nation of laws. I think we have to understand that there is nothing wrong with this country as a sovereign nation making decisions with respect to immigration law that are in the best interest of America. Sometimes I think when we're talking about international law, we're talking about international relations, we're talking about working with the United Nations, we're working about other peoples of the world, we lose sight of the fact that the first obligation of the federal government is to have the interest of the people of this country at heart. That the obligation of the State Department, for instance, is to represent the national interest of the United States. And so I make no apologies for the United States asserting that it has a right to make decisions in the area of immigration that are in the best interest of the United States. I guess the tough question is, what is the best interest of the United States? Again, I would say it is to show that we can be both a nation of immigrants and a nation of laws. So, I refrain from using the word comprehensive immigration reform because that has become a watchword or a watch phrase for amnesty. And I understand that. I avoid using the term pathway to citizenship for those who have been here illegally because that, in fact, is defined as amnesty, and for good reason in many circumstances. But I do think we have to apply a multifaceted response to a multifaceted challenge or problem. So, first, in order to gain the confidence of the American people, we have to admit that when we did the last major immigration reform, we've had some bills since then, but I'm talking about the major immigration reform in Simpson-Mazzoli, we did fail to implement the enforcement side of things. The American people understand that. They think they were shortchanged. I think they were shortchanged. We have to admit that readily. That is part of the context in which we have to deal with the issue, and I think we have to therefore accept it, acknowledge it, and learn from those mistakes. So we need to have a commitment towards enforcement. We need to have borders that are controlled, not just because of the issue of immigration or illegal immigration, but because of the threat in a period of asymmetric warfare or an asymmetric threat where those who are committed to do us harm are not just nation states, but maybe transnational terrorist organizations, or maybe those that have been known as lone wolves who are incited by, inspired by, and committed to the values that have been expressed by those terrorist organizations who spread their venom around the world, seeing who might be attracted to it. And if, in fact, you have a situation like that, you ought to be even more cautious than before about those entering into this country with terrorist thoughts and terrorist and terrorist desires against this country. So for any number of reasons, we need to have a commitment to controlling our borders, number one. Number two, we have to acknowledge that one of the magnets or one of the pull factors causing people to come to the United States or inviting people to come to the United States is the prospect of employment that does not consider the legal status of those who seek that employment. And so that's why I think an E-Verify system or something very much like that has to be a part of what we do. Third, we have to acknowledge that in the area of agriculture, there is a proven need for foreign workers. And people can argue about it, but I would just say, look at the example of the state of California, my home state. We've seen that for well over 100 years we've relied greatly on foreign workers for agriculture. And they've been legal or illegal depending on whether or not we've had a program. I have for many years looked back on the Bracero program to see both its positives and its negatives. Its positives were basically categorized as a government-sponsored, regulated program that allowed people to come into this country to seek work in the area of agriculture and give them a legal status while they did. That's the benefit. That's the positive. The negatives are that in many ways there weren't protections for the workers, and because one who came under the Bracero program was tied to a specific worker, if he or she had a complaint about that particular employer, that if he or she had a complaint about that employer, they often found themselves back in their home country before they ever had any adjudication of that complaint. So I think you have to devise a program that would determine the number of people that come here, determine what circumstances they come here, determine what areas of the country they can be here, but in a sense allow them to be free market, free players in a free market that is defined by the job, that is agriculture. And particularly because of the seasonal worker nature of much of agriculture that they engage in, to allow them to go from employer to employer. There are enforcement mechanisms you can put into place to ensure that they stay in agriculture, and there are significant penalties that you can apply if they fail to get a job or get a job in agriculture. One of the things that I've had as part of any proposal that I've presented is that you take the amount of money that would go into Social Security, the employer and the employee contribution, and that goes into a fund that first is responsible for paying for the administration of the program, so there's no burden to the taxpayer. Secondly, that money would go into a fund that would pay for any cost incurred by local jurisdictions for emergency medical care that was rendered to those individuals. And third, that which would be remaining would go into a fund that is for the contribution by the employer and the employee for that particular individual, be dedicated to that individual, but would be redeemable only if they returned to their home country and were physically present there. If they weren't, during the period of time they were supposed to be home, they would not have that fund. That money would be forfeited. If they did, they'd be able to redeem that money back in their home country. My idea would be that they would be able to work in this country for 10 months out of any calendar year, and that they would be able to go back and forth during that period of time. Because one of the things we've discovered is that as we have increased our ability to enforce our control of the border, if someone successfully gets across the border to work in the United States, they now have a great incentive not to return home for fear they won't be able to make it back. So in a very perverse way, the very success of our increased enforcement has made it more likely that they will stay here permanently rather than return to home. So we need to develop a program that is based on the facts as they exist. And participation in the program doesn't put them on the road to citizenship. It doesn't grant them any rights with respect to citizenship or permanent resident status. It is a temporary worker program. I do not think that other industries have proven the case that they need those kind of foreign workers. I really don't. In terms of construction, for goodness sakes, why do we have the high unemployment rate among African Americans in this country and among Hispanics who are here legally in this country when the construction trade is a great trade to learn, is a wonderful way to be able to earn one's living, and has an opportunity for people to move from just someone working at the job site up to learning their trade and becoming a contractor or subcontractor in some ways. So I would not suggest that we expand the guest worker program that I'm suggesting beyond agriculture, but I do believe it is appropriate in the area of agriculture. Probably the most difficult thing to deal with in this entire arena is the question of those who have been here for a substantial period of time in illegal status, illegal immigrants who have been here for a long period of time, those that have put down roots in the community. And there are those that say, look, the best way to do this is just take care of the problem by putting them on the road to citizenship. And there are those who have suggested things such as voluntary departure or enforcement of some other mechanism. And while I appreciate the sincerity and the thinking that goes into both those positions, my belief after being involved in this for over 30 years is that neither one of those positions is going to ultimately succeed. So what do? In baseball we have something, you know, when you pitch a ball is pitched to the batter wants to get the wood on the ball. He wants to hit it in the sweet spot, right? He wants to be able to maximize the energy that is generated by his swing against the ball, and one of the best ways to do that is to hit that sweet spot in the bat. So I've been looking for the sweet spot on this issue. Some people call it the midway, some people call it the compromise. I call it the sweet spot. It seems to me that we could do this, and I've proposed this in legislation, and I would hope that at least it would be considered in the next Congress by those who will remain. And the idea is that you would identify those individuals who have been here for a significant amount of time, and of course that's up to decision by the future Congresses as to what that time will be. Is it 5 years? Is it 10 years? I mean, what is it? But I think you'd have to establish what characteristics of roots in the community would identify these individuals. Certainly you wouldn't grant this to someone who just got in the country yesterday or last week, I don't think, because I think that would then encourage further illegal immigration in the future. People say, hey, look, they make it fairly easy, they're going to do it down the line. So you have to understand about the consequences of the impact on those who are looking at it from afar as well as those who are immediately impacted. So you first determine what the period of time would be that would establish them as people who have roots in the community. Secondly, I think you have to make sure that they haven't committed crimes of another nature. The crime of coming into this country, remaining in this country illegally, but not any other crimes. And people say, well, gee, it might be this crime or that crime, you know. Well, you know, that's a consequence of your action. I think this would be for those people who have not committed other crimes in this country. Secondly, it seems to me, there ought to be a requirement that they know English or are engaged in the study of English. Why do I say that? I'm not opposed to foreign languages. I wish I knew some foreign languages. I have enough trouble with English. But if we are a country of immigrants, as we profess to be and as we are, I believe, you have to have some unifying, identifying characteristics that bring you together. One is a sense of the understanding of the civil institutions we have, but certainly one is the manner in which we express ourselves. So a common language, I think, is particularly important to a country of immigrants. It brings us together, it allows communication, it allows us to come together as community without giving up or in any way disparaging our heritage. So I would have that as the second requirement. Third, it seems to me, there ought to be a requirement for a study of some of those civil institutions of our society. There should be an understanding of what the essence of the democratic institutions are. Because people coming from other countries have other traditions, other systems. I'm reminded of this when we had large-scale refugee numbers coming into this country. I was a young attorney in Southern California. I remember going down to Camp Pendleton with other attorneys and volunteering our time to teach those in the refugee community, and that was one of the places that they first came in California, to Camp Pendleton, before they then found sponsors and came to other parts of our country and the state, giving them simple instructions in the law, in the way the courts worked, in what your rights were. Fairly elementary, but nonetheless necessary. And it indelibly impressed on me that some of the things we do in our system are not immediately apparent. And people from different backgrounds, different cultures, different countries may not appreciate it. And if they are coming here, one of the great things about this country is assimilation. And so that's why I would require a study of civil institutions and our governmental structure among them for those individuals. Next, people talk about a particular fine. And I don't know what that number would be, but I understand that to be appropriate. Now, under those circumstances, what would I say they have? Would they go to permanent resident status? No. I would create a new category of legal status in this country called a blue card or red card, whatever you want to call it, in which they would, for a period of time, maybe 3 years, maybe 5 years, but they could repeat it. They could re-up this. During that period of time, they would have legal status in the United States. They could work in the United States, live in the United States, go to school in the United States, but they would not be on the road to citizenship. In order to do that, they would have to have a touchback in their home country, and they would get in line behind everybody else. Now, why do I think that's important? I think at the base of the objection to amnesty, as ever you understand it, is this idea that it is unfair to cut in line. If you're a kid and you're at school and you're waiting in line to get a drink of water, you're waiting in line to go to the bathroom, you're waiting in line to get your lunch, and you see somebody cut in line, you immediately know that's not fair. We all know that's not fair to cut in line. And so why should someone who didn't follow the law cut in line in front of those who have waited in their own country for their opportunity to come to the United States? So my sweet spot in this particular argument would be that while you have an ability to remain in the United States, in order to get on the path to citizenship and not give you an advantage over somebody else from your home country, you must touch back in your home country and you must get in line behind everybody else who followed the law. I think that is an approach that at least ought to be considered. I'd hoped to be here in the next Congress to be able to raise that and to fight for it and to see how others would view it, but I won't have that opportunity. I hope to be on the outside in whatever I do, to have a chance to continue to influence the debate, following whatever the lobbying rules are. I know I can't directly lobby, but hopefully as an American citizen I can talk about those issues in that first year, and I can talk about why it's important for us as a country. And yes, I've said this in our own conference, it's important for us as a party, my party, the Republican Party. We have to understand the dynamics that are involved there. I've seen it happen in my home state. I've seen what the political implications are, and I think we ought to pay attention to them. But beyond that, far more important than that, far more fundamental than that, is the fact that this country has to confront this issue in a reasonable fashion, in an intelligent fashion, in a fashion that improves the state of this country. So, I know there are men and women of goodwill in this House and in the Senate who will and can work together. I would make a humble request to the President of the United States that he toss aside partisanship and that he join those members in the Congress and those of us who will be in the public, out in the public, in an effort to try and deal with this issue. With all due respect, when the President of the United States went down, I think it was to El Paso a couple of years ago, and said Republicans want to build a fence and then they want to build a moat and they want to put alligators in it, that is hardly an invitation to cooperate. That image in and of itself, when you realize the history of the Rio Grande, when you realize the history of people coming across the Rio Grande to this country, that image is devastating. It does not open people's hearts to the possibility of reaching a compromise. It drives people away. And so my hope would be that the President would, as Ronald Reagan did in the 1980s, work with those who are in the House and the Senate to try and come up with a compromise that deals with the issues of this day under the grand rubric of immigration, and that, putting aside partisanship and political advantage, would work in good faith with members of the House and Senate to accomplish this task. And I would ask this, that those in this House and those in the Senate and those in the administration, under the direction of the President, begin working on this early, not late. If the work is done early, as we did in 1985, the chances of being able to actually accomplish a completed legislative vehicle and have it on the President's desk for signature are greatly enhanced. Don't wait till it's campaign year politics, and certainly don't wait till it's the next presidential election year for politics. Try and work on it now. This country is lesser for the fact that we haven't dealt with an issue of this importance. This country is lesser for the fact that we have all the tensions that exist as a result of a failure of the law to respond to the realities of the time. And we put ourselves in a conundrum where, in just one instance I would cite, men and women in the farm community in my home state of California who have farmed for generations have seen the reality of the labor market for agriculture, are men and women who are patriotic and love this country and want to follow the law, who in fact would support an E-Verify system which would allow them the certainty of having legal workers, but who on the other hand recognize the need for foreign workers. These people would be put into a no-win situation, a catch-22, where on the one hand they would be forced to follow the letter of the law, knowing that they would not have the workers that would allow them to continue in the generations-old farming business that they have, or on the other hand, as patriotic Americans in their own way nonetheless be forced to break the law in order to retain their livelihood. That's unacceptable. That is short-sighted. That is self-defeating. And it is something that we should not allow. Now, it's easy to get up here and do a special order and talk about how I would solve the problem. It's much more difficult to have a completed solution to a problem. And I understand that. I in no way suggest that this is easy or it will come quickly. But I do believe we have men and women of goodwill, of patriotic hearts, who can and are prepared to work on this issue. And I would hope that the President of the United States, now in his almost in his second term, would understand the seriousness of the issue, the immenseness of the challenge facing us, and would understand that in the best interest of the United States, it would behoove us to work together to solve the problem. I'm not sure what I'm going to be doing in the next year, but I do know that I want to be involved in the debate. And hopefully, I could applaud my colleagues who remain here as they succeed in dealing with this very difficult problem. So, Mr. Speaker, I thank you for the time, and I thank my colleagues for listening to me, and I encourage my colleagues to deal with this issue in the spirit of goodwill that I know they have. Thank you very much. I yield back the balance of my time.
Under the Speaker's announced policy